Another interventional radiology option is MRI guided focused ultrasound surgery. This procedure uses ultrasound waves to hit and destroy the fibroid tissue, and by so doing, get rid of the bleeding symptoms. The third strategy will be surgical options, including myomectomy or hysterectomy. And these options may be recommended in more severe cases. Myomectomy involves removing the fibroids while leaving the womb intact, but in a hysterectomy, the entire womb is removed. These procedures may provide a definitive solution to stop fibroid-related bleeding. Sometimes fibroids may come back after a myomectomy, but they can have complications related to surgery, and sometimes after a myomectomy, the fibroids can come back. Still, it's important that you carefully consider these options and decide with your healthcare provider which may be more suitable for you. The fourth strategy involves lifestyle modifications. Often, the first step in managing abnormal bleeding from fibroids is by making some lifestyle changes. But please note, these changes may not directly stop the bleeding. Still, they can help to reduce the severity and improve your overall well-being. What are these changes? Number one, maintain a healthy diet. Incorporate iron-rich foods such as leafy greens, legumes, and fortified cereals to combat the anemia that arises from heavy menstrual bleeding. Also include foods that are high in vitamin C, like citrus fruits, strawberries, and broccoli to increase your absorption of iron. Number two, regular exercise. Regular physical activity can help to improve blood circulation and promote hormone balance. This can be useful because fibroids growth and development are sometimes thought to be as a result of estrogen imbalance. So consider low impact exercises like swimming, walking, or yoga, as they are gentle on the body and can help to relieve stress. And while we're talking about stress, number three, another lifestyle change is stress management. Chronic stress can worsen bleeding symptoms, so finding effective stress management techniques that work for you is particularly important. You can practice relaxation techniques such as deep breathing exercises, meditation, or just engaging in hobbies or activities that make you happy. And what about the fifth strategy for managing heavy bleeding from fibroids? I think that alternative and complementary approaches can help some of us. So in addition to lifestyle modifications, medical or surgical treatments, alternative and complementary approaches may help some women manage fibroid-related bleeding. Let's talk about some of them. 1. Herbal remedies and supplements. Certain herbs like chasteberry, green tea, castor oil packs, vitamin D supplements, dong quai, yarrow, and ginger can help balance your hormones and may contribute to reducing bleeding from fibroids. However, it's really important that you consult with somebody who knows what they're doing, that is a qualified and trained herbal practitioner, before using herbal remedies, as well as your own regular medical provider, because some of these herbs could interact with other medications that you're taking. Secondly, acupuncture. Acupuncture is an ancient Chinese practice that involves the insertion of thin needles into different points along the body. This is thought to promote balance and healing. Some women have reported reduced bleeding and improved overall well-being after acupuncture sessions. So if you are looking for ways to stop bleeding from fibroids, you can consider one of these options: hormonal or non-hormonal medical treatments, interventional radiology, surgical treatments, lifestyle modifications, and even alternative or complementary therapies. Some lifestyle changes and alternative therapies can vary in the way they help women with bleeding. For example, they may provide only small or moderate benefits, and you have to keep up with them. You have to continue them to maintain any kind of benefit. So remember, managing fibroids is a journey, and finding the right approach may require a combination of strategies to meet your own special need. Don't forget as well that fibroid symptoms can affect women differently, and so some treatment options may not be effective for everyone.